So now we go back to this breaking news because we're learning more about the condition of Defense Secretary Lloyd Austin, obviously one of the most powerful people in the U.S. government, has, as many men across the country have, been treated for prostate cancer. But then there were some complications, and he was in ICU. Joining me on the phone, Dr. Marc Siegel, NYU Langone Medical Center professor of medicine and a Fox News contributor. Dr. Siegel, always good to have you with us today. I'm curious, obviously you haven't treated him yourself, but you have listened to the statement by the doctor who did treat him about the infection that followed a week later and what they found and how they treated it. Can you give us your take on what you heard in the statement from the doctor who is on this case?
Yes, and Martha, good to be with you. And I have to tell you, I think there's more obfuscation going on here. Even now, I'll explain. First of all, Secretary Austin should have come forward because 2.5 times more black men get prostate cancer than white men, and 2.5 times die more. And we're trying forever in the doctor's office to increase our screening. So he could have been and still can be a spokesperson for that fact. Secondly, they call this an elective procedure, but this is major surgery from the way I'm reading it. Minimally invasive, to me, that implies they use the robot, the Da Vinci robot, which is a huge step forward. So it can be done through two very small incisions, if I'm right, that they used the Da Vinci, and you don't lose a lot of blood, and it's a major step forward, and he's probably cured. We pray to God that he's cured. But that is not what I would call an elective procedure, even if technically it is, because you don't have to have it emergently. People think of nose jobs as elective procedures or something cosmetic. This is elective technically, but I think it's the wrong term to use. And minimally invasive implies it's minor when it shows biotechnological advances that we can now do that. Then to your question, he develops an infection which can happen after any surgery. And then, they thought it was urinary at first. Then they found fluid in the abdomen, and it was pushing on the bowel, and they had to decompress the bowel while they treated the infection. Again, modern medicine came to the rescue, and thank God he seems to be okay. This can happen after major surgery like this.
All right. Did we lose Dr. Siegel?
No, I'm here. I'm here
Dr.
still.
Siegel there.
I think I'm still here.
Oh.
I hear you.
Okay. All right. I think we caught most of that, Dr. Siegel. Thank you very much. And obviously, yes, infections can happen, and it was surgically removed. We're looking at prior images here of General Austin. Marc, thank you. Doctor, always good to have you with us.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.